Welcome to Plexus Health. The digitization of everything demands us to be closer to our customers, while cybersecurity threats and compliance demands are more real than ever. Furthermore, we are at a crisis of change, as the healthcare industry makes a critical shift from a fee-for-service model to a value-based, outcome-driven model. To thrive, innovation is essential, and innovation demands openness, yet security must not be compromised. Thanks to Axway AMPLIFY, we take this challenge head-on. We do this through powerful new customer experience networks and leverage APIs to secure a variety of digital channels, from IoT to mobile to web. Let's take a look at some of our digital services and how patients and doctors are networked to interact with us to improve the overall experience.
Hey, I'm Maya. I live on the go and on my mobile device. I expect the same level of convenience from my healthcare provider, just as I do from my bank and other services in my life that give me full access 24 hours a day. Plexus Health's new mobile app does just that. It allows me to quickly, conveniently, and securely communicate with my doctors, manage my appointments, and much more. Recently, I developed a rash on my arm, so I'll use the app to get a quick virtual evaluation, which helps me determine if I need an on-site visit. The diagnosis result is low risk, and over-the-counter treatment is suggested with an optional follow-up. I'd like to play it on the safe side and choose to see my doctor. I schedule an appointment swiftly from the app and I am done. So it's back to work now. If this fully clears, then I can use the app to cancel that appointment.
My son Bart is chronically ill. He was born with a rare autoimmune disease, but also has type 1 diabetes that needs to be managed. Given his overall condition, it is very hard to keep up with the demands. See, I'm raising 2 other children, and Plexus Health has been a tremendous help in Bart's care. He is constantly monitored through an insulin pump, which sends data to the doctors and my mobile app regularly. Through this mobile app, Bart's care team stays in constant communication with me, and as a result, our number of hospital visits is way down. Thank you so much, Plexus Health.
Hi, I'm Matt. I'm an avid cyclist and a runner and have torn my ACL and need reconstruction surgery. I need a fast and smooth recovery. Plexus Health has given me access through an online web app to set up and manage my surgery schedule, pre-op and post-op, as well as access to my personalized information and to manage follow-ups. The health portal makes this easy, as there are numerous appointments required and lots of steps I need to take on my side. After my last surgery, I came home with stacks of paperwork from various visits and could not keep up to ensure I was taking all the right steps in my recovery. Having a single place to engage with my doctors and care plan makes a big difference. Thanks, Plexus Health.
Hi, I'm Regina. As a doctor, the digital services offered by Plexus Health help patient engagement and benefit me and my practice, my staff, and most importantly, my patients. First, more engaged patients translate to healthier patients and better outcomes. Second, patients expect, even demand, instant access to information. And third, the physician apps reduce the burden on my staff to provide critical and time-sensitive information. Finally, coordination. My schedule is better optimized, and remote monitoring as well as virtual visits reduce unnecessary trips for patients. I recognize savings in time and costs. The overall patient experience is far better, and health is up. It's a win for both patients and doctors, like me. Thank you, Plexus Health.
Behind patient engagement is access to data. The secret ingredient to realize a multi-channel experience for our patients is API. APIs must be controlled, tightly secured, and published for use and discovery by our front-end developers. We manage security at every layer, from the applications that use the APIs to which APIs each developer can access, and of course security for the APIs themselves. We manage each by the internal or external group responsible for it. My application portfolio here includes the mobile patient care app used by Maya, the Plexus Health Center used by Matt, the various wearables that leverage the APIs, such as one used by Bart, and the physician's application suite. As we drill down into the patient care mobile app, we control which APIs each application can access. Developers cannot use an API in their application if they aren't explicitly given access to it. Before exposing an API, we add security and protection in front of it. This becomes our virtualized front-end API. Applications interact with these front-end APIs instead of directly communicating with the back-end API, which is the actual connection to the back-end system. Virtualization is key to protect our data, the data of our patients, our organization, and the back-end systems. The possibilities of virtualization are endless and go beyond the security layer. We can add throttling for older back-end systems that may have some difficulties handling high loads. We can add actions such as mapping, data verification, and even call other systems before engaging with the back-end systems. When ready, the APIs are published in our API catalog to expose them to the developer community. Each developer has individual access to the API portal where they can discover the API documentation. The developer can only see the APIs they are allowed to work with and have access to. With Axway AMPLIFY, security, compliance, and innovation come together. Part of management is measuring success and managing risk. Axway AMPLIFY provides out-of-the-box analytics for my APIs and allows me to track the digital channels in production. I continue with the same concepts, applications, and APIs. As a product manager, I have a global view for each. Here we can see a quick view sorted by the top active APIs or top active applications. For applications, wearables logically have the most activity as they are always on. I can see my patient care mobile app coming in second place. For these applications and their APIs, this allows me to look at adoption trends, current day trends, historical use, as well as errors or exceptions. When we drill down into the EMR System Patient API, I can see the API's usage profile through the day as well as through historical trends. I can also see the applications that are using this API, such as the mobile patient care app, as a top consumer. Important here is that if I have errors on this or any API, I can quickly assess the impact. Overall, having insight in the API's health and usage helps me to keep the quality high and continuously ensures that our APIs run smoothly. We can address problems before too many users experience difficulties. Customer experience networks powered by Axway AMPLIFY drive a more engaged patient population, which translates to healthier patients, better outcomes, and reduced healthcare costs. Thanks to Axway AMPLIFY, I have and run an efficient digital business.